So please welcome Jesse Dillon and David Rosenman.
Okay, which chair, Parker? Okay.
Jesse Dillon,
Hi.
thank you for being here.
Thank you. Nice to be here.
We're going to dialogue now.
Okay.
Ladies and gentlemen, please welcome Jesse Dillon.
Thanks. Can you hear me? Yeah. Okay.
I think, yeah. Can you hear me?
Yeah.
We probably don't even need these mics.
Yeah.
Do you want to just?
No.
So, you are a uniquely talented person.
Oh, thanks.
What I ask is that you chime in
Sure.
when you disagree.
Okay.
How are we so far?
Good. Yeah,
Okay.
good.
And you are a storyteller.
Yep.
You are an interpreter. You are.
Yep.
And you do a really good job of what you do.
Yeah.
I think we have, yeah?
This sounds good so far.
Jesse Dillon is a filmmaker of sorts. And I think we have a compilation of the work you've done. A sampler.
Yeah.
Would it be okay if we played
of
that?
course. Yeah, it's fine.
Let's play that. This is some work that Jesse and his team have put together.
You don't give up on anyone.
The task of our generation is to build a global community where people of all persuasions can live together in peace and harmony.
Creative Commons is this bridge to this future. Is you got to move away from thinking about content to thinking about communities that develop around content.
Any of us who've been a teacher before, we know that moment when a mind is unlocked.
So it's sort of the last years where you can create a good impression on someone or rearrange someone's outlook or perspective on life and the choices they're making.
I think in a generation where we have so many blogs and so much quick information and little sound bites, and even if you really are committed, it's very hard to know who to trust and where to go.
We just try to get people involved in things they see going on at CGI to come and plug into them. Some time, some skill, some product, some amount of money. Everybody's got something to give.
This could have been you, this could have been me, and they need a hand.
It's up to me.
It's up to you.
It's up to all of us.
Stand up to cancer.
If we inhibit access to the internet's resources in some way, you will also foreclose a great deal of experimentation.
We need an institutional drive to say, we value this.
And every story has value.
So the first thing you have to do as an artist, the first thing you do, is you notice that the world is beautiful and there's something worth explaining. And then you find a language that allows you to, if not explain it, then begin to make sense of it.
The first thing we want is to find out everything about the universe, to find all the rules. And of course, that's the last thing we want because we don't want the adventure to end.
I reckon this world needs children to kind of remind us to know which way, we want this world to go.
If we see something and we can do something about it, we should do it. We shouldn't wait or delay.
Now we have a chance to serve these heroes.
You and me.
All of us. Coming together as one. One.
As one.
Who will you look out for?
Please join us.
Yes, we can.
There you go.
Did you really do all that?
I did do all that, yeah.
Now you work with all political parties, right?
I do work with all political parties.
And the sorts of organizations with whom you collaborate, with whom you've worked, how would you characterize them? It seems like a pretty broad swath.
Well, I try and work with people who are all trying to do something powerful in the world and need help explaining their stories. The most common thing that I see is that you'll have really brilliant people working on something, but the last thing that people think about is how you communicate that idea. And so what happens is that an incredibly powerful thing people don't know about it, they don't opt into it, and then that idea fails. So most of the organizations I work for are usually doing something which needs a little bit of help to talk about so that people understand what it is. See, it's usually two forms of things that I do. It's either the inherent meaning of something, like the Harvard Medical School, where they're trying to talk about innovation in the medical school and how they can make that better as an idea, which everybody in the school knows about but doesn't know how to put into words, or the things I do for RED or the Gates Foundation, where it's like you're trying to make something that's about a message that attracts people to look at something. And usually the most common problem that I see in organizations is they might want a cool ad, but then you bring them to some place and there's nothing there for them to actually respond to. So it's one of the biggest challenges, I think, for all organizations is that at the end of the day, what we're really talking about in a medical context is shared values. You want to patients, doctors, researchers all want to congregate on an idea together, but it's ultimately about what do we see that's the same about all of us and why we should do it. Because technology really doesn't, it only has one purpose, which is to make people's lives better. So it's kind of like all that stuff is in the way of what the message is. The message is the higher calling of the institution, whether it be in a medical context or in any context. It's trying to find the things that are the same about us.
So you mentioned some work around innovation at Harvard Medical School.
Sure.
Could you tell me a story that uses the words innovation and either healthcare or medicine?
Well, I mean, I don't know if there's a specific story, but I think most things are talking about, aren't innovation, they're iteration, and usually they're product iteration, right? So that's iPhone 3 becomes iPhone 4. That's not really the innovation that we all need. Like what we need is to have, we need brand new ideas, so that what happens is and to do that, I think is going to be, there has to be a mixture of old strategies that have worked, because a lot of good things are out there, but also getting younger minds or newer ideas into the mix so that we can actually achieve some of these things. It's obviously medical conditions, both on the lab side and on the care side, are very, very difficult. And I think that not enough resources are put into innovation in care, where I think that I hate the term low-lying fruit, but there's a lot of ideas in care that can be innovative and really, really help people. And I think that, it's very difficult to find ideas that are powerful. And then once you find an idea, it becomes really hard to figure out how to distribute the idea. That's the challenge,
I do. And
sure you do.
I do. So you said a couple of things that are really interesting to me. One is that there's a lot of opportunity to innovate around care, which is what this whole event is all about.
Sure.
Which is really the mission of the Center for Innovation that hosts this.
Sure.
It's really transforming the experience and delivery of healthcare.
I remember that when you showed it to me.
Yeah. Is that right?
Yeah.
Transforming experience. Yeah, I got that. So, and it's transforming it for the better, but it's the care part. So I know a little bit of a story that you shared with me about your son.
Yeah. You mean, how did I get interested in this area, as interested as I am?
Yeah.
My son was, he had Crohn's, celiac, and functional pain. And ultimately, to get the celiac diagnosis took 3 years, which you test, it's a blood test. And, it was incredibly frustrating. I went home every day and I looked for information. And I couldn't, you search, his stomach ache every day. So it's like I'd search every day and try and find the information that was available on the web. And it isn't that there isn't information on the web, it's that there's a sea of information. And as a patient or a loved one, I had no ability to navigate. I had no authorities within that I could trust. I couldn't get to any even rudimentary clinical guidelines to understand, what the clinical effectiveness was of the drugs he was taking, the things that were working for him, and the things that weren't working for him. So my belief is that to really, and he's ultimately fine now, but I think that we, as patients and physicians and researchers, we deserve to have these clinical guidelines be available to all people, because what it would do is it would make it possible for a patient whose journey is very complex and they know a lot about it to be able to research their conditions and be able to go back to the doctor as a better prepared patient, and it would lessen their stress to have this rudimentary knowledge be able to be known, just what is known about the clinical effectiveness of a given condition. The anecdotal information can be powerful, but the issue is that it has to be given in context. It's not powerful if you don't trust the authority that gives it, and it's not powerful if it's not in the place that's specific. I don't need to know about how somebody reacted to Imuran that doesn't have Crohn's. I need to know that when I'm in that part of the disease phase, I need Crohn's. My doctor just said, Imuran, it's not working for me. What else is possible for me? So it's a lot about how we, I think that design plays an incredible role in sorting out these very difficult problems that we have right now, very underutilized at this point. And on a tangential note, I think it's important to get designers who are thinking about other things, products, and I think it's important to get musicians and filmmakers all engaged in trying to figure out how to make the communication part better. They're not doctors, but they have a role to play.
So if you had been doing research for your son, trying to figure out what the best option was for him and for your family, let's say that you had clinical guidelines available to you in some form that were in a language that
5th grade reading level
that you understood. Or a 5th grade reading level.
Would it have been better for me?
What would your experience have been?
Well, my experience would have been a much better advocate for my child, because I would understand where we were in the spectrum of the disorder, and I would be able to. I had no ability to really research this combination of conditions, and I went to very good gastroenterologists. So it was not a question of them not wanting to give me the information. It's just that we should have a base where we understand what where we are in the. I don't think it's a problem to provide people with that information. I think that a lot of other things become more powerful. I think that right now you have different modalities, you have all this different information, but ultimately a patient just wants to get better. And so they're willing to try things, but the thing is you don't have a single website where you could go and look at clinical effectiveness for both Imuran and yoga as it relates to Crohn's disease. And there is clinical effectiveness for those things. So the question is there should be one place where you can go and at least start your journey, because otherwise what happens is what we have now, where we have people saying, I treated my cancer with well water, and that's not effective for anybody. So it has to be approved. There is a level of anecdotal information. I don't know where the line is. I'm not qualified to say because I'm not a doctor, but the point is there's things that can be included, there's things that cannot be included. There's all sorts of issues that have, we were talking about Parkinson's earlier, and people are concerned whether it's a environmental or it's hereditary. At the end of the day, what a Parkinson's patient needs to understand is the spectrum and where they are in it. That's the only piece of information that's relevant without a diagnostic test. And the promise of these statistics that are out there now is that I think in the next few years, we will have a better understanding of that condition without doing any tests on any people, just by understanding all of the data statistics that go around it. So I think it's an exciting time for sure.
For sure. And how might, from your view, and I know you've done work on the research side in a number of areas, from your vantage point, I know you have an interest in the visualization of data.
Yeah.
We share that interest.
Sure.
I know that you have been involved with neuromyelitis optica and other conditions. Also, Ian's LAMSite project, you're well aware of.
I'm a fan of that,
A fan, we both are, we all are. So these are global networks. These are databases that coalesce from which new data can be mined. How do you see, from your vantage point, the paradigm for research, which has a fairly well understood model in the last century, changing in the one that's ahead of us?
Well, I'd like to think, if I was wishing for things, right? Like I would wish for a set where all these data sets were out open, because they should be open source. And the thing is that you'd build a UI on top of it that was really simple, available to everybody, so that a cancer researcher right now has to be a great cancer researcher. They also have to understand how to run a Boolean code, right? The power of Google is that I type in chair and up comes a chair. Well, if I had that for statistics and I had that for medical information, I could just get to the clinical guideline, which isn't even that expensive, what we're talking about in the world of expense. It would make the innovation and the ideas that would come from the statistics would be incredibly powerful, especially if you just built a system and gave it to people, because what could happen is people who had their own ideas, unrelated, would be able to sift through it and use it and find those statistical anomalies that are not science in and of themselves, but are the beginning of understanding. One of the things here at Mayo, you were talking about NMO, the way that NMO was, NMO has the virtue, it's a variant of MS, and it has the virtue of having a diagnostic test. And the reason that it has a diagnostic test is because here at Mayo, researchers are required to talk with clinicians. So a clinician got up, gave a speech, and the researcher said, wait, I know exactly what that is, had some things, went back, and they had this moment, right? Well, people would say, when I ask about it, people say, well, this is an accident, right? But it's not really an accident. We together went to the Mayo Brothers offices here, and they said, I don't know how many years ago, 70 years ago, there are going to be these meetings where people exchange information. So what they did was they built a system that lived out way longer than them, which is not really, you can't replicate it. It's not easy to replicate, but it's more than just, it's people. It's those people exchanging those ideas that led to that. So, innovation, to really achieve the objectives we all want, there has to be a system in place. We talk about the web. There is no system online that does that. And, it's the kind of thing DARPA should build again, like they built the internet. I wouldn't hold my breath. I don't think it's coming anytime soon, but I wish it was, because I think that there's going to be a lot of incredible science that can come out of it.
In the minute or two that we have left, will you tell me a little bit about what Libba is?
Well, Libba is my own nonprofit, which is it basically is about providing clinical guidelines to people free of charge, and then it works with institutions to help them, communicate ideas. So what happens is with Cincinnati Children's Hospital, we got a transformative R01 grant from NIH to help these 15 clinics communicate. 15 pediatric Crohn's clinics, all practicing slightly different ways, but one idea. The different variations, the question becomes, which innovations are they doing individually that could be adopted by the entire system? And this is the same problem that I see with Council on Foreign Relations, where I work with them on the idea of how the best idea in foreign policy come to the top of the organization, which is the same idea as the Gates Foundation. How do we get better education? It's a common problem where we have lots and lots. The problem now is not information. The problem now is context. It's how do we get better context? Some of Ian's slides up there showed Fernanda's work. I forget her last name, but that's an attempt from IBM is attempting to figure out how to discern deeper meaning out of statistics. And I think that we need a lot more people like that doing that. I don't do that, but there are very few people who think about this problem of data statistics, and I've tried to get them to work on health-related matters quite a few times, and what happens is that it's really hard to pique their interest. If you wanted to know the location of every taxi cab in New York, they're in, but if you want to know, what the underlying proteins are in a certain condition, it's very hard to get them to visualize it. Although I have seen some things that have been really promising, and I think that they're just going to get better and better over time,
You commented to me when we were standing back there before the beginning of this discussion that your impression is that there are some people here who represent some of the very few remarkable people in the world.
There are some remarkable people here I know from other places.
You are one of them.
Oh.
And the work that you're doing is really worthwhile, and I am grateful to you for coming.
Thank you for having me.
Thank you.
Thank you, Rick.
Okay. Thanks a lot.
Yeah. Good. Okay.
Right there. Are you ready to take a break?